Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogrammed Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. And Chantal Donnelly, physical therapist and author of Settled, How to Find Calm in a Stress-Inducing World. Here at City Club Los Angeles, we follow our guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome to the ANEW Insight Podcast at City Club Los Angeles. I am Dr. Supatra Tovar, and I am honored to have Wellnest President and CEO and Chair of City Club, Charlene Dimas-Peinado, with us today. Thank you so much for being here.
Thank you. Thank you.
Hey, I'm going to read a little bit about Charlene, and then we'll get right into our questions. Charlene Dimas-Peinado serves as the president and CEO of Wellnest, a distinguished organization in Los Angeles dedicated to providing trauma-informed behavioral health and housing services to children, young adults, and to families. With over 3 decades of experience in behavioral health and nonprofit leadership, she has significantly expanded Wellnest's reach and impact, emphasizing innovative programs that tackle mental health disparities in underserved communities. Notably, under her guidance, Wellnest celebrated its 100th anniversary in 2024. I was there. It was epic and beautiful, marking a century of commitment to mental health services. In addition to her role at Wellnest, Charlene serves as the chair of Board of Governors for City Club here in Los Angeles, a prominent social and business club in the city. She also holds leadership positions with other organizations, including the Los Angeles Chamber of Commerce and the Natural History Museum, as well as Rotary LA 5. Her dedication to mental health and community well-being has earned her recognition as one of the top women leaders in Los Angeles. Charlene, I'm so honored to have you here today.
Thank you. Thank you, Dr. Tovar, for inviting me to be here. And we are just thrilled to share all the great work that we are doing at Wellness.
I can't wait to hear more. And I really want to delve into your history. I want to know everything about what motivated you to pursue a career in mental health, but also how did this journey lead you to becoming the president of Wellnest?
So I was born and raised in New Mexico, and grew up in rural New Mexico, small town, and a small town where it was a close-knit community. And I often witnessed my own mother just perform these random acts of kindness. And I always say she was a quasi-social worker. So I saw that, growing up as a child. And then, my dad was a World War II veteran. And so there was always commitment to serving and, contributing to our community. And so with that foundation, I always knew that I wanted to go into the helping profession. And so that's really what, helped to inspire me to serve others. So I went on to college and got my master's in social work, and then became a licensed social worker and got trained in child and family psychotherapy, and worked as a psychotherapist in a community-based mental health service agency, and just loved the work, and was able to experience the importance of doing trauma-informed work and the impact it had on children and families, and how it could really make a difference. So being able to experience that and see the impact, it really inspired me to continue to grow in my professional services. And that's when I pivoted to doing more administrative work, where I wanted to make sure that we were growing services so that there would be more accessibility, affordability, and that they would be available to all children and families, regardless of their socioeconomic situation or whatever community they may come from, because access and affordability is so critical in being able to provide mental health services when it matters the most.
Absolutely. Absolutely. So give me just a little glimpse into your career progression. you started as a psychotherapist, and then when you went into administration, where did you serve?
So I, worked my way up from being a therapist to supervising students, and then from there became a associate director, and then from there became an executive director. Was the CEO for another organization serving the suburbs of here in Los Angeles, and I was there for many, many years. Then I got pulled here to LA. My predecessor at Wellness was retiring, and so they were doing a nationwide search, and they found me in Whittier. And so I came to LA, and I was, my youngest was going off to college, and it was a good time for me to kind of, lead another organization. And so it was a good time for me to come to LA, a big city, and an organization that had amazing legacy and history, which I loved. It was formerly known as the Los Angeles Child Guidance Clinic. And, we, together with my staff, we rebranded the organization to its new name, Wellnest, Emotional Health and Wellness, because we wanted to move away from governmental names, the history of pathologizing children and reducing stigma, and using changing the narrative, using content that was focused more on emotional health, emotional well-being, wellness. These were terms that landed more comfortable in our communities. And so we established a new vision, a new mission, new vision, new core values, and have been using this to continue to promote and support education around mental health and the idea of speaking openly about mental health.
Absolutely. And you mentioned, and I think we hear the term so often, trauma-informed care. Can you just explain to the listeners who don't really understand what that is, what it is exactly, and how did it differ from how people approached mental health care in the past?
So I'll share personal experience. Just, as a child, I come from a traditional Latino Catholic family, 8 children, and I was the youngest. And my mother had another baby after me, and that baby died like 3 days after birth. And then, and I was about 4 at the time, and so not a lot of discussion around that. Remember my parents were of a different generation. And then a couple of years later, I was in the car and experienced my older sister dying because we couldn't get her to the hospital quickly enough. And so within a couple of years, I had experienced losing 2 of my siblings. And I remember at that time, I remember being in first grade, and I remember going to my teacher, and it's funny how you remember things. And I remember saying, did you know, Miss Barbie, that 2 of my sisters just died? And I looked at her, and she did not know how to respond to me. And she just said, I know, go sit down. And,
oh my goodness.
And then, and my mom was grieving the loss, and she went to the priest, shared how she was feeling, and the priest's response was, you have so many other children, focus on your other children.
Oh my goodness.
And that was not uncommon.
Yes.
Okay, is that we just did not talk about it. So then, I grew up in a household where my parents did not know how to talk to us about the loss. And so we didn't talk about it, And so we just lived our lives. And these are experiences that children have, whether it's the loss of a parent, the loss of a grandparent, a sibling, a loved one. And we need to be able to process that loss so that we can move on. And so from that experience, I witnessed my mother grieving silently, because we all have to grieve. And oftentimes we will grieve silently, or we will look to other unhealthy behaviors to cope.
Of course.
And so so from that experience, I and then going on to college and doing internships, and also recognizing that families were affected when there was a mental health issue, whether it was a mild or more severe one, such as bipolar, schizophrenia, and the loss that families would experience and the impact it would have on them emotionally. And oftentimes the difference it would make if they sat with a therapist and had the opportunity to just speak openly about what they were experiencing, process the information, and begin healing from it. And really it required the support of others to help normalize, because these are universal issues that we all experience and need help with. And so from that, I just, going, through my adulthood and my profession and recognizing, oh my goodness, we need to do more and more of this. And through time, we have gotten better. There is more resources. There is more accessibility. We still need to bring parity to it, as it relates to access to, affordable care. There's been some great legislation being pushed every day. The governor right now has a mission to transform the mental health system here in California. All of that is making a difference. And then all of us also need to, especially, like ourselves, continue. This podcast makes a huge difference in getting the message out.
Yes.
That it's okay to talk about it,
Yes.
educate, and just go get help when you need help. And you don't have to worry about whether or not it's affordable. There's always services there for everyone.
Yes.
Wellness is one of those agencies. We don't turn anyone away. And mental health starts from the moment a baby is born all the way up to the end of your lifespan. And we can never lose sight of that.
Yes.
Because we experience all these life transitions differently as we, are aging, right? And so it's not uncommon that at each phase of our life, we may need to, recalibrate and ensure that our emotional well-being is intact, and that we are seeking the support that we need from outside resources. Of course, our loved ones, our family members, and professionals.
Yes. I'm so glad that mental health care is changing in this direction. And if you kind of look at the history, I was just at the Los Angeles County Psychological Association's conference, and we had Daryl Sue, who's a very prominent researcher, and he's written kind of the textbook in terms of multiculturalism in psychotherapy. If you look at the history, it was so Caucasian, white male centric.
Yes.
And what is wonderful is that it's really expanding and opening up and depathologizing especially conditions we find in minority communities.
Exactly.
It used to be, so racist centric, saying, it's a problem within the community, as opposed to this is a universal problem.
Exactly.
So I'm so excited that you are at the forefront of this.
And let me say something about that. So when Wellness was founded in 1924, and as I mentioned, it was the Los Angeles Child Guidance Clinic, and it was subject matter experts and community leaders that came together and founded Wellness. And the idea was that we needed to do it differently. We needed to ensure everyone had access to professional services, that they were cutting edge, because at the time, who was talking about children mental health? Nobody was, right? And then also, it was a time when in communities of color, they didn't even feel that people of color could participate in psychotherapy.
Yes.
Okay?
Yes.
They did not feel that they would attend appointments or that they had the ability intellectually, okay, to process the insight-oriented psychotherapy that would occur.
Yes.
Now, one of our psychiatrists, who was one of the first African-American psychiatrists, Dr. James, who came to Wellness, he was also connected with USC and all the universities, and was able to demonstrate through research that, on the contrary, that was not true.
Good.
Okay?
Thankfully.
Because what they did with people of color, when they were seeking out mental health, they were either hospitalized or medicated or placed in groups.
Yes.
And not given the opportunity to participate in insight-oriented psychotherapy services.
Yes.
And he was able to demonstrate through his research all of the people, children and adults and families that actually were able to move on from the trauma and heal from the trauma and lead normal lives because they did benefit from psychotherapy.
Yes.
So those experiences throughout the years have helped us to continue to evolve and continue to, promote and support the important work of trauma-informed services.
Yes.
Because it does matter and it does help us heal from our trauma.
It absolutely does. And tell us, as the first Latina president and CEO of Wellness, I love saying that because it's just so beautiful, how do you approach leadership and what unique perspectives do you bring to the organization coming from your cultural background?
So I bring a visionary yet hands-on approach to leadership, blending a strategic direction and personal experience to the position. As I mentioned, I'm a psychotherapist, I'm a Latina. I understand culturally what are the needs in not only the Latino community, but other communities of color. And it's very important that we continue to grow services for all communities, but also ensuring that we are competent, culturally competent, and culturally sensitive to meeting the needs of our community.
And would you say the wellness community is primarily Latino?
It's actually predominantly Latino. Right now we're serving 3 geographic areas: South LA, Downtown LA, and East LA. We continue to grow our geographic footprint to serve the greater Los Angeles area. So it is predominantly Latino and African American, but even that is changing. Okay, and so the other important role I play is ensuring that we are growing, that we are sustainable, and that we are relevant to the needs of our community, which could include different ethnic groups, languages, right? And ensuring that our staff are highly trained and are able to, again, meet the cultural and trauma needs that our communities will have. Because children and families are coming with different experiences.
Yes.
We have children and families coming from other countries who have experienced trauma.
Yes.
And just imagine right now everything that's going on. And again, our staff are well trained to ensure that we're going to be able to address those traumatic experiences in a way that is going to, again, help our children and families develop and build that resilience they need to cope and manage successfully.
Yes.
Because we want our children to be successful in their homes, in their school, and their community.
Oh, and plenty of research has shown that if children receive mental health services, housing services, any kind of services that help them move along, they have such a better chance at succeeding as they age and go into school and go into the community.
And, you're speaking to the social determinants of health, right? That our environments will impact our ability to, be an emotionally healthy individual, because those social determinants of health include housing, our community, access to good schools, access to good jobs for our families, our environments. Are they, do we have clean air? Do we have access to good doctors, medical education? All of those things is what helps us to prepare for adulthood and become contributing members to our communities.
Well, this organization, 100 years old, and I have to tell you that your centennial celebration was just such a special, amazing event. Give us some insights into how this organization evolved. I know that you have rebranded it, but just give us a little bit of a picture of the evolution of wellness.
So as I mentioned, it was first developed in 1924 as a small agency. And then the idea was, again, to bring cutting-edge innovation to the community for children and families, but to also be a training organization.
Yes.
For future psychotherapists, psychologists, and psychiatrists. So that was also part of our evolution, that we were a training organization. And we began as a diagnostic assessment and treatment agency. So when you came to wellness at that time, you were going to be able to build your skills because it was all happening right then and there. They were bringing in the subject matter experts and then students to train them so that they could serve, whether it was the same organization or other organizations in the community. So at this time, we were the first children mental health agency on the West Coast, and then others followed. Okay, so you can see we were already setting that trend, and we wanted others to replicate our models. And so from there, we just continue to build on that, grow the organization. You know, we started at the Baldwin Hospital as a, which was in the baby unit with a small staff. Then went on to the USC campus. Then from there, just with the growth, built our first building on Exposition in Vermont. And now we're at 7 locations and continuing to grow. We have 2 housing developments in the pipeline right now. So soon we'll be at 8 locations, 9 locations. So just that evolution, the need, the sustainable growth. Part of the sustainable growth is as a result of cross-sector collaboration. We simply cannot do this work alone. So that's also part of our evolution, is partnering with healthcare, schools, other public organizations, private foundations, community, because philanthropy also plays a big role in the effectiveness, our effectiveness, and our ability to grow our services. So that cross-sector collaboration has been part of our evolution as well. So when we celebrated our centennial, we celebrated our past, that we have survived, including a pandemic.
Yes.
A worldwide pandemic that destroyed many organizations, but we survived it.
Yes.
And then to thinking about the future, what do we need to continue to do? What are the current needs and how are they changing, and what are we doing to be responsive and relevant?
I know as a psychologist, having gone through training, how important the philosophy is of an organization. And I've been in ones that are wonderful and then ones that really need some extra help. As a training facility for future therapists, what do you hope that they take with them once they're done training with you?
So that's an excellent question. So we at the agency, we utilize various evidence-based practice models that have been well researched and demonstrate that we will have good results.
Yes.
So again, I mentioned training is very important. And so from that, we want them to be able to either stay and continue to be part of our staff, and many are, or that they go out and they take their skills to continue to serve children and families and continue to think innovatively of how they're going to help other communities where they may go, right? Because they're going out into the community and serving all different types of agencies, right?
Yes.
I think the other thing that's really important is that they understand we're all moving towards this integrated care approach.
Yes.
Is that you cannot just, we're complex as individuals and we're multidimensional. And sometimes the issues we're dealing with are multidimensional. There may be issues of generational trauma that haven't been resolved. So again, being sensitive to these issues that individuals may have and the impact as it relates to the entire family system.
Yes.
Okay. So although we serve children, we serve the entire family in the context of the child. So the importance of looking at the environment, looking at the community, and just taking that approach to not only recognizing whole person, but also the importance of accessing as many resources as you can and helping to create a supportive community for that individual and that family, and taking a very holistic, integrated approach to that care.
Yes, so I'm getting evidence-based care. I'm sure you probably are training in CBT, DBT, all of the, especially the trauma-informed care practices, but also really helping people look at a client from a biopsychosocial model where you're looking not only at the home environment, but you're looking at all of the different layers that, impact the child.
Exactly.
On that note, what do you think are the most salient difficulties that children, especially in Los Angeles, but in general, are facing today? I mean, I think there's a wealth of things if you're looking out in society, but what are you seeing in your practice?
So there are 3 areas right now that our young people are being impacted the most. And the symptoms and behaviors that they're struggling with are a tremendous amount of anxiety,
Yes,
depression, and the suicide rate is high. Right now, it's the second leading cause of death for young people ages 10 to 24 in the United States.
Wow.
Okay. Now, COVID has really had an impact on all of us. So think for a second, as children, your whole life was disrupted. The social isolation was very disruptive. You weren't able to go to school. You weren't able to see your friends. Many children, and especially in our communities, lost loved ones.
Absolutely.
Many of our children lost their parents, grandparents, siblings because of the virus. Many of our community members were essential workers that were not protected, that were out working every day and were exposed and came home, and either they became very ill or also, spread the virus. Many children went into foster care.
Yes.
Because they lost their parents.
Yes.
So the impact was horrific.
Horrific.
Yes.
I
And
did
we're
my,
still trying to recover from it.
Yes.
Okay.
I did my internship in a community mental health organization in Los Angeles right before the pandemic. And all I could think of when the pandemic hit was, I wonder what's happening with the kids that I treated and, what is going on in the community. And you're painting a picture that is very heart-wrenching.
Absolutely. Now, the other issue that we're seeing is technology.
Yes.
As much as it serves as a great purpose, and we all use it, I use it, for our young people, we need to look at how can we better support them in appropriate usage. Because oftentimes young people, especially adolescents, they're engaging in that social media where they may get likes and great feedback, but it's not a person. They're not developing interpersonal skills, and it's also contributing to isolation and loneliness.
Yes.
It's very important that we help them to understand the value of social skills, social interactions with people, to develop those interpersonal skills and to reduce the social isolation.
Oh, yes.
Right now, the millennials are the most lonely group of people right now. They are experiencing social isolation and loneliness because, remember, this is native to them. This is what they grew up with.
Yes.
And they were, there's a lot of reinforcements, but it's the right type of reinforcement that they should be having. So, again, we're starting to see that we're recognizing that this is not such a good thing, and everything, needs moderation. So just helping our young people to understand this is good to a certain degree, but then what are you doing to interact, to build relationships, to develop your social skills, to problem solve, right?
Yes. I work with a lot of adolescents. I work with them with problems with eating, eating disorders or disordered eating. And social media plays, I think, one of the biggest roles in, the difficulties that they're facing in mental health, because they're seeing this very limited view of a certain kind of, quote, ideal. I put it as an ideal because it's really an unhealthy ideal.
Right,
and I help them really look at their social media feed and determine for themselves, how are you feeling when you're looking at this material?
Very good.
If it's negative, if you're feeling terrible about yourself, do you have to follow these certain people?
Exactly.
I help them kind of reprogram their social media feed to great success in terms of their improvement in mental health.
Right.
But I absolutely think you're right, and I do think the pandemic itself was devastating for everyone. Kids especially, because they fell behind in school. They had difficulties with online learning. And we have so much that we need to help clean up. And so I'm very hopeful that we're past that emergency and now we can do all of this repair. And it really sounds like you're doing that.
Exactly. And, eating disorder, we're seeing a rise in eating disorder with young girls.
Yes.
And so that's the adolescent phase is a very vulnerable time.
Yes.
Because this is a time where you're individuating, developing your own self-identity. And so when we're being influenced by social media that often is skewed or not reality-based, then we need to be able to help our young people understand that. And I really love what you said and helping to guide them and step back and have them reflect on that and come to their own conclusion that this is not a healthy interaction for me to have and how I need to redirect that.
Yes, and you can have a healthy relationship with social media.
Yes.
I mean, especially if you're like me and you only follow like puppies and kittens and pandas, and, just like baby goats and things like that. It can be a really wonderful place to go and decompress and, see what's good out there in the world. But you have to curate your feed to be able to do that.
And I just want to add one more component is that as parents, as adults, as caretakers, whether, and I'm a mother or I'm an aunt, I'm a sister, the important role we play also, and also helping our community, helping others, and again, helping them to, know, look, you're not alone in whatever you may be facing. But also we play a very important role in demonstrating what being a healthy person looks like.
Yes.
Okay.
We have to model.
Yes.
For
modeling
the kids because they're little tiny sponges and they watch everything. I always counsel my parent clients, like, be really careful what you say in front of your child because you may end up regretting saying that.
Exactly. And you often speak about the importance of, healthy eating and fitness, and those play a very important role in our emotional well-being as well.
Exactly.
So thank you for everything you're doing in that space as well.
Thank you, Charlene. Well, we are out of time for this half of this podcast, but we're going to be coming right back for the second half, and we cannot wait to learn more about Wellnest President and CEO and Chair of City Club, Charlene Dimas-Peinado. Thank you so much, Charlene, for coming.
Thank you, Dr. Tovar.
Yay. Thanks for tuning into the ANEW Insight Podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Body Insight Podcast tab. Follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.